Community leaders in the high desert are taking action to combat the high rate of opioid overdoses in the region. The High Desert Community Coalition is distributing naloxone and providing training on how to administer the life-saving drug properly. The coalition, which formed in 2012, is made of dedicated community members who are focused on addressing alcohol and drug-related public health and safety issues in Victorville, Hesperia, Adelanto, Apple Valley, and surrounding areas. Between 2020 and 2021, opioid overdose deaths significantly increased in all of the high desert cities, according to the most recent data attained by the California Overdose Surveillance Dashboard. In Adelanto, opioid deaths increased an alarming 325% over the one-year period. In Apple Valley, opioid deaths increased 213%. In Victorville, they increased 90%, and in Hesperia, they increased 70%. To stop this disturbing trend, the HDCC is distributing Narcan, a naloxone nasal spray which is used to address a known or suspected opioid overdose emergency in a non-responsive individual who displays signs of slow or shallow breathing and severe and unusual sleepiness. The HDCC obtained several dozen doses of free Narcan through the Naloxone Distribution Project, which is funded by the State's General Fund and opioid settlement money administered by the California Department of Health Care Services. Since it began in October 2018, the NDP has distributed more than 2,080,000 kits of naloxone, which have been used to reverse more than 133,000 overdoses. Law enforcement, fire, EMS, schools, and universities are already eligible to obtain standing orders for free naloxone through the NDP. Community-based organizations and harm reduction coalitions can also obtain the drug, but the process can be confusing. This is why the HDCC is committed to helping other organizations secure their own Narcan through a Train the Trainer program.
And it's a two-step process for getting Narcan. If you do it incorrectly, it's going to hold up your shipment. So we need to check with you and be sure you get it done right. Thank you.
Our coalition is proud to be on the front line in distributing the drug to those most in need. But we also realize the immense value in helping other organizations get the spray and develop a distribution plan. We must force multiply to prevent these tragic deaths, said Mike Gramphorn, who also serves as a commissioner on the San Bernardino County Department of Behavioral Health Commission. With technical assistance provided by the Institute for Public Strategies, a local nonprofit, the HDCC has mapped drug overdose and possession clusters in Victorville, which helped the coalition pinpoint its first distribution efforts in Old Town Victorville. This is a much-needed harm reduction intervention for the high desert. I have heard stories of fentanyl being mixed with illegally prescribed medications like Xanax and Percocet, along with other stimulants like methamphetamine and cocaine. Most folks can't even afford to pay for Narcan prescriptions, so it's imperative that we provide this drug free to stop all of these overdoses. The HDCC has already begun distributing Narcan to a handful of local hotels, smoke shops, liquor stores, just wherever drug sales and possessions have been documented by law enforcement, along with shelters, food pantries, and other community service organizations.
The bottom line is people are dying and we need to prevent it. We know our local school districts and first responders can now obtain and administer Narcan. But we need to make sure this critical drug is also readily available to reverse overdoses with our entire population, including those who are most vulnerable.
For more information on how to obtain Narcan and training on how to administer it, please contact the High Desert Community Coalition at area code 442-229-4912 or email us at hdcommunitycoalition at gmail.com.